Welcome all, and thank you for joining today's panel discussion on the California Community Schools Partnership Program. Really appreciate you taking the time out of your school days to be a part of the conversation. This panel is intended for school administrators, educators, coordinators who are really at any stage of the community school process, whether you're applying for the first time or have existing community school sites and are expanding resources, or perhaps you yourself are new to your district's pre-existing programs. But we have a great panel who can speak to a broad range of experience there. And the intention is to simply learn from how your colleagues across the state are approaching this work and see if you can potentially get some support. So let's get started. First thing, a recording of this discussion will be sent out by email, and we will also save time for questions at the end today. So please feel free to write those questions into the chat whenever they come to mind so we can make sure that we respond to you. We'll start by introducing ourselves. For those of you in the audience too at this point, please go ahead and put your name in the chat and your school district so that we can say hi and see how you're doing. We have a small group, so don't feel shy about adding any questions. And I see some familiar names and some new ones, which is lovely. So I'll just start by introducing Daybreak Health briefly for those who aren't familiar. Daybreak is a school-based mental health service provider for students and their families, and we partner with districts across the country, including about 60 LEAs in California, and that includes a few community school partnerships. So our programs are primarily virtual therapy, both one-on-one and family teletherapy when we're working with younger kiddos. And we also provide on-site clinical support and other tools like our mental health screener, impact metrics, supports for family engagement, mental health education. So lots of flexible options to build each unique partnership within a district. And we're in network with Medi-Cal and most private insurance. So that's a very basic intro to Daybreak, but today we will be focusing on insights from two incredible partners of ours who are at different stages of their community school implementation. So without further ado, we have actually 4 panelists today. Unfortunately, Jenny Saul was not able to join us, but I left her here for honorable mention. So I'll pass it to each of you to introduce yourselves, just a brief intro to your work and a little bit about your school district and community for some context. So we can start with Dr. Ruiz.
Yes, hello. My name is Erlinda Soltero-Ruiz, and I am the Chief Academic Officer for Educational Services in the Fullerton School District. That is close neighboring districts, Anaheim, Buena Park. So thank you for joining us today. And yes, Jenny Saul, my program specialist, is not able to join us today. But hopefully we can help you out in this process. But we truly appreciate your time and being here. Thank you.
Thank you so much. And yeah, just for a little more context, Fullerton School District has some existing community school sites and seeking to potentially add some more with this current grant funding round so we can get some experience from both sides of the spectrum there. I'll pass to Superintendent Aldridge to introduce yourself.
All right. Good afternoon, everyone. I'm Joe Aldridge. I'm the superintendent for Fort Bragg Unified School District. We're up here in Mendocino County, out on the lovely coast, though it's a little rainy today. And we serve 1,700 students in grades pre-K through 12. Our demographics, we have about 80% of our students are qualify for free and reduced lunch or unduplicated in some way. We have 20% of our students are multilingual learners. About 14% of our students are in special education, and 50% of our students are Hispanic or Latino, as identified through demographics there. We are in the first year of the implementation of our community schools grant. So we're looking at all these options and excited to share some of that with you here today.
Thank you so much. Great. Martha Lopez.
Good afternoon, everyone. My name is Martha Lopez. I'm the Community Schools Coordinator for Fort Bragg Unified School District, and I am very excited for this opportunity to be sharing information and the great things that we're doing at Fort Bragg Unified.
Thank you. And last but not least, Cicely Bega.
Hi, I am Cicely Bega. I work with Daybreak Health, helping districts apply for grants. We help source grants and also help with the drafting process. So I am here to hear from these great districts and be of service to anybody who might need some additional help. Thank you.
Great, thank you. Yeah, I was just in another meeting with you getting the rundown on that kind of process and all the different levels of grant funding that you've been supporting some districts with. So fresh in our minds. And I'm Erin Weaver. I work alongside Cicely at Daybreak Health on the school partnerships team. So let's set the context a little bit before diving into the Q&A. I'm going to put a link in the chat that I'm sure you've all seen from the CDE website, which describes the California Community Schools Partnership Program. And this describes the community school as a whole child school improvement strategy where the district and school work closely with teachers, students, families, and partners, support schools' efforts to partner to align community resources to improve student outcomes. So community schools often include family engagement services, integrated support services, and that is often where a partner like Daybreak comes in to support sites like those in Fort Bragg and Fullerton. And the strategy also emphasizes the 5 identified conditions for learning. So those are outlined in a framework which you can download from that link in the chat. And those conditions include that the mental and emotional and physical, of course, health needs of young people and their families are both recognized and addressed. So right now, applications are open for the implementation grant for cohort 4 until February 7th, which shockingly is coming up, February 7th, 2025. And this is to support it's to support the establishment of a new community school and or the expansion or continuation of existing community schools. So I'll put that specific link in the chat, but again, I think this is nothing new to you. So let's share this here. Let's get started with questions. And one more reminder, audience, please ask your questions in the chat and we will respond to them at the end. So my first question is for Joe Aldridge. So when you're looking at your district's identified areas where students are struggling and the solutions and strategies outlined in your LCAP, what is your vision for community schools in Fort Bragg Unified, and how does that align with your broader goals?
Well, I think the beautiful thing with the community schools grant and our community here is that we were kind of already working towards some of these goals. We just didn't know that it was community schools. We already had a lot of the stuff in place, particularly with the COVID funding that came through. We were able to really increase our mental health supports for kids. We have partnerships in the community that are really great, supporting the physical health and other aspects for our families. So we're able just to deepen those partnerships a little bit. And so our goal is really to ensure our students get what they need through really us as a community hub. And we're in a rural place and it's an hour to get to the major city of Ukiah, which if you've ever driven through, you know I'm joking about that. It is, it's really limited the services that students have access to. And so we're really trying to envision ways to keep them here in our community served well and back at school, because we have a high absenteeism rate just simply because to go to the dentist, you'll have to take an entire day off to get out of the area if you can't be seen by a local dentist here. So we're just really looking to bring those services in, ensure that students have the connections that they need, and deepen some of the academic and other great expanded learning pieces that we have in place. I look forward to talking a little bit more about that as we move through.
Thank you. Yeah, I appreciate that perspective about, for your community specifically, being so isolated and rural. A lot of those areas that you've already been working on improving kind of set you up for success to be able to get started, because the way that you're approaching your community is already kind of what is outlined by this model or this strategy. So I appreciate that. And how that kind of community struggles with absenteeism with it in its own ways, with transportation and everything. So my next question, thank you, is for Dr. Ruiz. So you have had, as I mentioned, community school sites operating for a couple years now, I believe, and are planning to apply for this next round in hopes to open more sites. So who are your stakeholders in that process, and how are you working together to get those first steps off the ground?
Thank you for that question. Yes, we are part of cohort 1. We had 6 schools receive that award, and then cohort 3, 2 schools. So we have a total of 8 schools right now that are community schools. We are only missing one of our Title I schools. So, like you said, applying for the next round. But I believe as a district, we already have our stakeholders well involved in our school sites. So taking a look at what we've already established, our ELAC committees, our PTA committees, our school site councils, starting off with principals of the potential schools, doing a needs assessment. What are your needs currently right now? We were seeing a lot of the mental health concerns in our communities. So you'll hear later on are not a struggle, but a blessing, I say, for our district to have 2 different mental health opportunities for our families. But then again, just looking to see who else can we have as potential partners in this. So we have our vision partner, our dental partners, even the local pharmacies, where we just kind of looked in the general area of our parents who were in need of mental and physical assistance, and seeing who can we go to assist us with our partnerships this year. So we established the local pharmacies as one of the keys that we hadn't tapped into. So just taking a look around, because everything is there for you. You know your community, you know what the basic needs are. And part of being a school principal, you do have to fill out your school plan. So why not tap into those school plans? So we used a lot of the schools' action items for their school plans, our LCAP as well. So a lot of the things that we're already doing, that we have information that feeds straight into that application. So take a look at those documents. Those will be a big help. Having a meeting with the principals ahead of time. Your pie in the sky, what do you want for your community? So that's what we did, and that's what helped a lot with our planning process and answering the questions on the application.
Thank you. Yeah, I appreciate that. Just going to the principals for those school plans that, again, similar to Joe Aldridge, those already exist. There are a lot of needs that have already been identified, and plans are in place, and you can leverage that in a new way. All right, my next question is for Cicely. So in regards to applications, what strategies can districts use to demonstrate sustainability and long-term impact in their grant applications?
Sure. So it is common for grant applications, of course, to ask how the district is going to sustain a program after grant funding has ended. In our example, Daybreak helps district partners with this through our ability to collect and bill insurance to offset the cost of services. Also, thanks to Daybreak's dashboard and reporting capabilities, we're able to provide the district with extensive data on utilization and alignment to the district's goals. This data can be helpful in applying for future grants and also for demonstrating program effectiveness and outcomes to your district leaders to campaign for more local funding for mental health initiatives when it's available.
Beautiful. And I'll actually open that one up. If anyone else would like to speak to that, since you're in the application process, Dr. Ruiz, anything that you might add on how you're speaking to long-term impact?
One of the items that we ended up ensuring that it was a gradual release that we've been doing with our school sites in ensuring that their advisory committee meetings are continuing. First, we assisted them. We were there providing information. We were running the meetings for them, but we started saying, it's your turn. It's your turn. So slowly doing that gradual release so that we can sustain everything that we have placed on the plan to ensure, okay, we said we were going to use this portion of the funds to have additional classes for your school site. How are we going to be able to continue? Oh, one of your parents is actually attending and is going to be now that expert in such and such so that you can continue and sustain those parenting classes at your school site. Through that advisory committee within the school site, they're able to come up with different ways or avenues to empower the people that are already there at the sites to be able to continue whatever programs or action items that we had in place already. So parents will take that empowerment and move forward. Oh, I teach a Zumba class. I can continue the Zumba classes here at our school site. Oh, well, why, can you do it as a district? So we kind of expanded on that. So we're able to use the internal resources that we have currently through the grant. We'll have somebody coming in, but if the grant money runs out, we don't have that continuation, then we have to be able to ensure that whatever we have in place will continue.
It's a group effort. So I appreciate that, kind of bringing the community together to start thinking about that just from early on, and keeping that in mind when you're looking at what resources are going to be appropriate for that fit. All right, well, my next question is for Martha Lopez. So on this same kind of topic of resources, partnerships in your application. So when you're looking for partners who align with your district's goals and the Community Schools Initiative, how did you identify and build relationships with the external partners that you chose?
I think it is important that to know your community, you have to be out there meeting not only with the parents. We are so lucky that Fort Bragg is a small community. Everybody wants to help each other. We are there for each other. And we're working together with the rural clinic, which is the Mendocino Coast Clinics, and we ensure that our families have access to medical. And the families are like enrolled in medical, and our students immunizations are up to date. So we work very close with that. We have bilingual family liaisons, and that's our goal. So far, we have 3. And their job basically is to build those connections also with the community, but also with our partners. Like we also work closely with Mendocino Coast Children's Fund as well, where they have a project like right now, it's Baby It's Cold Outside, which provide jackets for students. So we work as well closely with the police department for narcan trainings and for substance abuse help. And also something that I learned from another district is to reach out to the faith-based organizations. And that has been huge for us. We've been receiving help from the faith-based organizations by providing hygiene items for students. So just go out there, work with your community partners and with your families.
Thank you. Yeah, I'm hearing a common theme of just the more you know your community, the more that you are already well set up to understand what resources they need and may already have the beginnings of those relationships. And Martha, in your case, I know that you have been working as one of the bilingual liaisons for your district for a long time. And so you do have that strong connection and understanding with that community. All right. So, my next question's for Cicely. So, kind of piggybacking off of that, my question for you, is there an advantage of having a partner already in mind when applying for a grant, even when that partner can't be included in the application?
Yeah, I think there is an advantage to having a partner in mind versus just writing about your desired programs and services and without knowing if a partner can meet your needs. If the district can tailor their goals to fit a partner's program, you're likely also to have a faster implementation of services. For example, if a district can list elementary family therapy, for example, as a desired program and a goal of increasing family engagement overall, Daybreak's programs offer the match to the district's needs, including family therapy for elementary students, for example, family engagement program available to districts that partner for teletherapy. Knowing these and having these things in mind will help you to get a jump on you receive the funding. You already have your partners lined up and in mind to be able to go out and implement and start receiving those services even faster.
Perfect. Thank you. All right. So my next question was for Jenny Saul, but Dr. Eves, I'm going to pass this to you. So I know that Daybreak is not Fullerton School District's only mental health partner and not even your only virtual mental health partner. But I know Fullerton is using Daybreak's programs exclusively to support the community schools that you have. So what strategies were you using or are you using to guide your allocation of resources? And that's for you, Dr. Ruiz. Oh, who we might have just lost. Well, we can come back to that and I will try to get Dr. Ruiz back online. It's a day of technical difficulties, as happens sometimes. All right, I'm going to put a pin in that question. And let's move on here. And I have another question for you, Martha. So I know that Daybreak is supporting your initiatives with unlimited teletherapy for students. So could you connect the dots for us on how and why you chose a virtual partnership to support the community school? I know a lot of folks kind of when first getting introduced to the model think about on-site services. So connect the dots for us there.
So just like Superintendent Aldridge mentioned, we are a very isolated community. To receive just medical care services, sometimes you have to travel out of the area. Like the closest hospital, bigger hospital than the one we have in town, is an hour and 15 minutes. So we have to travel over the hill. And we don't have an OBGYN care at all. It closed 4 years ago. So that gives you an idea of our situation here. So we don't have the basic medical care for the rest of our bodies. So mental health is really, really a big need for our families. So we are very excited that Daybreak is available for us because there's a huge need for students to be able to receive teletherapy. And right now, I would like to share that we have a missing student, and the community has been looking for him. And I think right now Daybreak comes into a right time for a lot of our students because they're struggling. It's a student that is loved by many, but loved by the community. And immediately when we launched the program, for families register, like it was immediate. They meet that shows you the need. So we are very happy that this is available for our students right now.
Wow, Martha, thank you. My heart goes out to you and your community. That sounds really difficult and really stressful, and thinking about the impact that has on children is just a lot. So I'm grateful that we can be of support. And what you're saying also brings to mind, not only is, on a more surface level, it's beneficial to have telehealth when you're rural, right? Because you can access more resources, but you're also bringing to mind folks who are used to living without those resources. That's going to take then a greater toll on overall well-being and mental health. And so I appreciate you making that connection too. I was just going to say, Dr. Ruiz said that your internet went down. Thanks for rebooting. It happens. It's one of those days.
Okay. I'm
All right,
sorry.
well, I'm happy to get back to you with this question. I'm not sure if you caught it. So welcome back. And my question to you was about your mental health partnerships. So I was saying, I know Daybreak is not your only mental health partner, and you even have multiple virtual mental health partners. So I was hoping you could speak to the strategies that you are using to guide your allocation of resources, because I know of those partners that you are using Daybreak specifically for the community school sites. So what are the strategies guiding that?
So one of the things that we noticed was that our other partners do not offer family services. So, and the age level is different as well. So one of the responses on the needs assessments that we had for our school sites that are part of the grant was that the family needed the services as well as the student. So with Daybreak, that is the perfect partnership that we have to be able to have that for available for our families because we're not able to service the littles, but as a family, we can service everyone that is in need. Also, if we needed to extend it over the summer, Daybreak was our go-to to be able to include those services for our students over the summer, over breaks. It's just a matter of just extending. But I think based on what's allowable for budgets, take a look at those restrictions to be able to know who you can have on board, how much you can have on board, to be able to know which partnership you go with as well. But I think knowing through your needs assessment what our families need, that's what you're always going to be able to guide your ways and the resources that you use and the allocations that go towards that as well. But I think they were the ones that helped all of our community schools, but still we had other 20 schools to service in some way or another, but we were able to alleviate that and use Daybreak as well with the other resources that we have.
Great, thank you so much. Super helpful. And my next question, similar kind of segue, is for Joe Aldridge. So just wanted to hear from you, what best practices would you share for any individuals who are looking to build buy-in from among their colleagues and community?
So, kind of as you've heard Martha speak to, we do a lot to build relationships. I go around saying, in small communities, relationships really are our superpower. That's one of the things that we do extremely well and stay really connected with each other for all the good and kind of irritating things that sometimes brings, but we build really, really awesome relationships with folks. So that really helps in building the community for these different programs we have. We've gone out and met with folks individually all the way up to, speaking at Rotary meetings, getting on, news stories out on our local radio stations, those kind of things, articles in the paper. We do actually still have a physical paper in town that gets delivered around to people. So that's that's a decent form of communication as well. So, you know, that's the external is actually pretty well set up and works well for us. The internal piece also works well, but it's, you know, getting those two pieces to connect sometimes is the challenge of leadership. We used a lot of data to convince, you know, our board and our leaders that these things are needed. So, you know, you look at your California Healthy Kids survey, local climate surveys, things like that, just to build your case for the need. I think also coming out of the COVID pandemic, really, there were so many indications that really showed that this was a need that a lot of students were working towards. Though I'd say it was probably building even before that. You know, if you look at some of the most recent research around that. So we use those pieces to really make sure that our community understands what the need is and what our vision is in addressing that, and they helped us to kind of shape and refine that vision around to make sure that it's something that works for everyone. However, in working with like Daybreak, I haven't heard anyone come out and say, gee, that seems to be off base, because you have other programs that exist. We do have some mental health programs. One that we're pretty proud of is we have two folks who are, one's a teacher and one is a registered clinician who teach our students Aikido, and they build in mindfulness and other pieces and counseling through those supports. And so, you know, we're showing that we're really willing to go out there and find kind of unique solutions to the problems and use the resources that are around us. And our community really gets behind that support. We have a very practical community that thinks that using what's here and being as self-sufficient as possible is a really big value for them. So we're able to kind of show that, but we're also showing that we can reach out and find those partners when it's needed and really keep building that forward.
Beautiful. Thank you. Well, kind of on that note, I wanted to talk a little bit more about family and community involvement, because that's a huge piece when we're looking at the whole child model. And we could have our own panel on family and community involvement in and of itself. I will turn to Martha Lopez. So I mentioned, and you mentioned earlier, kind of your background with the district. And so I wanted to ask, how will the community school change the school experience for the Spanish-speaking families, specifically in Fort Bragg Unified? And similar to that, what's your vision for how this site will improve the way services are delivered?
Well, like you said, I previously was a bilingual family liaison, so that gave me a big picture of what was happening at all the sites. And then when I was able to become the community schools coordinator, I had that background. And now we're building our team of adding more bilingual family liaisons for each site. And something that I approached Superintendent Aldridge one time when I was still a bilingual family liaison, because I was at one side doing an observation and helping a family. And then an English-speaking family approached me and she said, I heard that you help families. And I said, how can I help you? And she said, I mean, these are my needs. And I said, come to our office. So I approached Superintendent Aldridge and said, we need to expand. We need to start serving everybody. We can not only focus on our Spanish-speaking families. Of course, they are in most need right now, but we still need to start serving everybody else. So that's one of our goals, to expand the program to have one family bilingual family liaison. It is important for us that the person is bilingual, because you heard, 50% of our district is Spanish speaking. So it is important to have someone that is able to communicate with all those families and to be able to understand what are their needs, and also to help them navigate the school system.
Thank you.
And I didn't answer the second question. The second question regarding what is my vision? My vision in the future is that we will be able to have for Bragg Unified the community hub for everybody, where we can serve our families, where they can or we can have a family wellness center and they can come over here and find the resources that they need.
Thank you. I do appreciate that. I just really like talking to our community schools partners because it sounds so visionary to imagine a school as this place where families can get so many services that you wouldn't normally associate with school. And it's just incredible to see how much work and dedication goes into that otherwise goes under the radar. And one thing I wanted to mention, I know Jenny Sala is not here, but I was really impressed to see that her program in Fullerton School District is launching a career pathways program for parents, which I haven't come across in the districts that we've worked with so far. And that just stood out to me as it sounds like an incredible resource and something, again, unless you have a really dedicated community school coordinator and folks really identifying what's needed in the community to be able to take the time to put something like that together, it doesn't happen. So thank you for that, Martha. And then my last question on this, I will open this up to any panelist who may want to speak to it. So when it comes to serving communities and families, as we've discussed, how do you gather data on parent and family needs and the effectiveness of services there? I know we tend to focus on student data, but how do you gather family data? Who would want to take that question?
Erin, if I'll take that question, but I'll piggyback on the career pathways program. That just give a little bit of information regarding that. So this was the brainchild of our superintendent, Dr. Robert Pleka. He when parents speak to him, they speak to him very frankly and ask him for whatever they need, and we grant those wishes. And one parent was saying that they were struggling with finding jobs or work because they didn't have those basic skills that the jobs were requesting. So he's like what? And it was welding, and it was drywalling, and it was just questions, answers that they were giving. So because our superintendent is well in tune with our community, he asked, can we do something? So Jenny and I brainstormed and came up with the Career Pathways program. So it is a 3-part session for parents, because like you mentioned, we do service the students. We're there for the students and we're on site, but the parents as well, they need some learning opportunities. And we have our parenting classes, but this focused in on building skills within our parents to be able to use those and go out into the workforce or bring in opportunities for them to learn. So our first session consisted of the Western States Carpenters Union, where they have a program, an apprenticeship program that they do with the local high schools. And from the local high schools, they connect the students straight with an apprenticeship if they go through their program. So we communicated with them, we got on board, and we said, does this apply for parents as well? Olders versus the high schoolers only. And they said, yes, of course. So we invited them to come over. And we had our first session this past Saturday, where parents were able to come and see what the Western States Carpenters Union was about, just to provide information to give them some connection for parents to go and be part of their classes, which we're not offering a class. We're just providing sessions for them to gather information to go and seek out. So our next 2 are dealing with the same opportunities. We're bringing in cosmetology, somebody from the cosmetology world, somebody from the nursing world. We have our local partnership with the North Orange County ROP classes that we have people that are already wanting to come and speak to our parents to have those connections for them. So we're looking forward to that, to be able to expand a little bit and grow it a little bit, but well attended our first meeting. So parents made that connection, and the presenter was, come see us at our office, one at a time, as long as we get one at a time. So there was that parent where it's like, I'll be there on Monday. And in the back, Jenny and I are like, yeah, just one at a time, we can do that. So that's a great opportunity, just expanding and just knowing what the needs are out there. But you asked about gathering data. So I'm going to see if I can do this and put this on here. So this little card, we made business cards to basically advertise who we are, our community schools, and our QR code, which goes directly to a form that our parents fill out, because sometimes they don't want to go and speak to the principal. They're scary people. So how else can I share what is it that I need and somebody that can help us? So we track who we help, where we help, numbers coming in, as well as we're providing services for making it individualized, because they were able to share personal things where I don't want to go to the principal, go talk to my personal business. Let me seek help my own way. So we pass these out to our psychologists, our school office people, and people up at the district office. So basically we're going around, just pass these out. Our superintendent, we gave him a stack because he's the one talking to the community out there. And it was easy, fill out the little quick survey, and we will get back to you. So, a little bit, helped us out a little bit, both angles.
That is awesome. I love that idea, Dr. Ruiz. Thank you for sharing that. Of just having, we can use technology to, all of these different folks are having different kinds of conversations with parents when they can, and just making sure that you're helping them to share what it is they want to say or ask without being, intimidated. And I know that can be a hard gap to bridge. And so check this out. I'm going to take a page from your book and share our QR code. Can you all see this QR up here? So we just have a couple of minutes left. I'm not seeing any questions in the chat, but I will say if anything comes up, they can be specific about the application process. If you have a question for a specific panelist, please feel free to enter that and we can get to it in our final moment. But I do want to say thank you, everyone, for sharing your experience. I know we've spoken with folks really across the spectrum of the information they're gathering and where they're at in the process. So I know that what you've all shared today is extremely helpful. And I just wanted to say, if anyone has questions that come up later or you want to continue the conversation, please feel free to reach out here. Cicely mentioned our grant support. So if that's what you're looking for, the contact us link is the place to reach out. So I'll put it in the chat. If you were looking for either grant support or specific community schools related questions, that's the place. So any final thoughts from any of our panelists on best practices you'd like to share for folks who are early on in the process applying for the first time?
I think I would just say, put your ideas out there, and even if they change over time, because ours sure has changed from the time we put in the application until the time we're actually implementing, do it. The worst they can tell you is no, and we've been told that before. So just get out there and put yourself out and really do what's right to help students.
Thank you. Well said. Well, thank you, Superintendent Aldridge, Martha Lopez, Dr. Ruiz, Cicely, Bega. Really appreciated having you all here. Thank you so much to everyone who joined. Please feel free to stay in touch. And otherwise, I wish you a wonderful afternoon.